I tell this to literally everyone that like Medicaid is like the best medical coverage that I've ever had in my life. I don't have to worry about going to the doctor. If my kid's sick, I can just go and like not have to worry about, paying for it. I worked for the state full time in the payroll department. I basically did data entry. It was really stable before I became a parent. And then when I became a parent, it was like I was in that really bad zone where like I did have insurance, but daycare cost about 60% of my take home income. And I didn't qualify for any kind of help. So I decided to join AmeriCorps. It's not income, it's living stipend for volunteer work. And it came out to like between $5 and $6 an hour if you did the math that way. I got on Medicaid because that was my only option for medical coverage, and I lived in low income housing for 2 years. When that was over, I started working part time for the nonprofit that I was volunteering with. There was like a year's period of time where they kept being like, "Oh, well, you could take more hours," and I'd be like, "Oh, but I can't. I'll lose my Medicaid." And of course, I'm a huge proponent of the Medicaid Buy-In Program. Yeah, so literally Medicaid saved my life. I've had mental health problems like pretty pervasively since I was 10 years old. So it wasn't until I was on Medicaid that I was able to even afford to like see a therapist, see a psychiatrist, to get a proper diagnosis and you know, find a program that is specific to my diagnosis and afford to go through that program and afford to, like be on medication. I've known folks who, they'd find a medication that worked for them, but then their insurance stopped covering it. When it comes to mental health stuff, your medication's really specific and that's really, really important. And then they had to like play around with like, oh, I tried this, it doesn't work. I tried this, it doesn't work, just to be able to fight with the insurance to get what they really need. I've never had to do that on Medicaid. I just can get my medication. And that has literally been life changing. I started this like a really like specific program. It's like a whole thing. It's a 2-year process. They forgot to put my Medicaid information in. So I freaked out. I got a bill for my first month. It was $1,400. And Medicaid covers all of it. Honestly, I don't know if I'm gonna be able to afford it once I get off Medicaid. But like I I'll figure something out because I have to. Everyone deserves healthcare, and everyone having healthcare helps all of us. Like it keeps our healthcare costs lower, and it keeps all of us as a community healthier. No one should have to suffer just because they can't afford healthcare. Like it's just vitally important.